condition we're talking about today can be extremely embarrassing. It can be caused by physical activity, coughing, sneezing, and even laughing.
It's called stress urinary incontinence, or SUI, and it's a very common issue among many women.
However, as we're going to learn today, SUI is not normal, and women don't just have to live with it.
Unfortunately, many women are living with it, like Dana and her mother, Debbie. Let's meet them both. There are different reasons for urinary incontinence. However, the most common type in younger women is called stress urinary incontinence, and it happens when there is stress or pressure on the bladder. Everyday actions that use the pelvic floor muscles, such as physical activity, coughing, sneezing, or laughing, can cause you to leak urine. It is a very common event, and it can happen for a variety of reasons.
I'm not 100% sure when the leakage started, but it was gradual. It wasn't anything time-wise I could pinpoint. It was just these odd times that it might have happened when I least expected it. In the meantime, it just kept progressing. I couldn't spin the way I wanted to spin. I couldn't get through a 50-minute class without having to go to the bathroom, and I said, this is not what I want. I've got young grandchildren, and I just want to be able to go and do and hike and swim and all those things which this affected.
Dr. Brianna Walton is a specialist in female medicine and pelvic reconstructive surgery. She's been in practice for the last 20 years.
Stress urinary incontinence, we also call it SUI. It is a defect in the pelvic floor in which there is weakness up underneath the urethra. The analogy that we use often is that there's like a hammock of tissue up underneath the urethra that is fused to the bone, and when that hammock gets stretched or even torn, the urethra isn't able to keep the urine inside of the bladder. And so when women have increased intra-abdominal pressure, like a cough or a laugh, they start to have leakage. The problem is that many women have this symptom and they often think it's very normal part of aging, but the problem we have with it is not normal. You don't have to live with it. It's a symptom that we can treat fairly easily. Most of my patients will come to me after having these symptoms for a really long period of time. They've been dealing with occasional leak with cough, laugh, sneeze, but then, as time progresses, they become less comfortable with going to the gym and starting to have leakage and having to wear pads, or not being able to participate in activities with their kids. Or intimacy is one of the big triggers for women to come into the office. When you start having leakage during sexual intercourse, it's one of those things that just says, I got to do something about this problem. Age is one of the biggest risk factors. If you are obviously a woman, or genetically, some people are more prone to leakage. But then there are other things that happen in our lives that actually incite stress incontinence, like our weight. The biggest risk factor of all is childbearing, not just delivering a child, but actually carrying a child.
After I had my C-section with my third child, I started noticing about a year later that I was leaking more than I had been previously. It was happening when I was walking, especially up hills, when I was running up and down the stairs, when I was lifting heavy bags. My children were at an age where they were being invited to a lot of trampoline birthday parties, and every time they went, I had an opportunity to jump with them, and when I jumped, I would leave with pants that were leaked on. It was annoying. I hated the fact that I had to cross my legs when I sneezed. I hated the fact that I had to pay attention to how full my bladder was, and sometimes I didn't have sensation that my bladder was full. It just didn't feel like it was aligning with the way I want to live my life. The doctor told me I had stress urinary incontinence, and it was most likely, in my case, due to 2 really challenging childbirths, and then a third pregnancy on top of that. And it was also part of aging. And it was just how my body was responding to the stress that it had endured.
Most women have joked about losing a little urine when they're with their girlfriends and, peeing a little bit. But I think the problem happens when you start to modify your activities. You stop dancing. You stop doing the things that you would normally do with your family. You change your routines. You go to the bathroom 2 or 3 extra times just so you don't leak.
I started with the pelvic floor therapy. I think it lasted probably almost 2 years. It helped, but it was a Band-Aid, and it didn't work extensively.
So I participated in about 12 weeks pelvic floor physical therapy, and it helped significantly. I noticed that the symptoms started to creep back up again. So I went back to the physician and I said, I'm not exactly sure what to do. And she said, at this point, I don't think any more physical therapy is going to benefit you. You're going to need surgery.
Coming up, a minimally invasive procedure for stress urinary incontinence.
Stay with us. Well, welcome back.
As we heard earlier in the show, after a frustrating journey with pelvic floor therapy for their stress incontinence, Debi and Dana continue to look for a treatment that's right for them.
Let's hear more of their story.
If the muscles have been torn or injured during childbearing, it's not really that helpful to do Kegel exercises. You're trying to exercise a broken muscle, so to speak. But this is not just a muscle issue, this is a tissue issue. So when they see me, I'm looking more for options that are more interventional. And those can really include devices that can go in the vagina to help to lift the bladder and the neck of the bladder up so that there's less leakage, or even progress to surgery. But a lot of women, especially my younger patients, aren't wanting to do that for years and years of their life. It's a great temporary option, I think. They're often surprised about just some of the surgical options that are available. One of them is urethral bulking, which we don't use a lot of because the data in the past have really supported that it wasn't a great long-term solution. If you are looking for something that is more of a cure over a period of time, we're looking at surgery. So the most common way to address incontinence is a mid-urethral sling. They are a minimally invasive procedure. They have excellent long-term cure rates, which are really important for, not just a 1-year fix. You want something to be sustained over a period of time. They can be done as an outpatient. It's a fairly short procedure. It takes us about 15 to 30 minutes to actually do it. And generally, patients are going back to their normal activities relatively quickly.
So I asked a lot of questions, trying to understand why surgery was the next step. And she explained that I had a couple of other options. She said that I could use an injectable, which may or may not work, and also had to be done a couple of times. And then the other option was to get a sling. I'm 45, and I don't want to be leaking when I'm 80. And so this sling is going to keep me from doing that.
I have tried a lot of different products over time, and the sling of choice for me is the Altis single incision sling system. The sling acts like a little hammock up underneath the urethra. It supports the middle section. It supports that tissue so that when there's increased pressure, it almost compresses the urethra so that urine can't sneak out.
The Altis single incision sling system is indicated for the treatment of female stress urinary incontinence, SUI, resulting from urethral hypermobility and/or intrinsic sphincter deficiency, ISD.
Slings are really highest on our list. They are our gold standard. They're our go-to procedure. In fact, I don't just do them. I actually had a sling myself because it was an easy way to correct the leakage reliably and for me to get back to my normal activities.
Women receiving single incision slings reported lower post-op pain, earlier return to normal activities, and earlier return to work compared to those receiving traditional slings. There are risks associated with a sling procedure, and a patient should discuss these risks thoroughly with their physician.
After I healed from the surgery, I really started feeling like myself again. I was able to do all the things that I wasn't able to do as easily prior to the surgery. There was no leaking whatsoever, and the best part was that I could play outside with my daughter again. And I never had to worry about leaking because it was completely gone. So while I was recovering, my mom was helping out, and I knew that she had struggled with stress incontinence previous to my procedure. And she revealed that she was starting to get a little curious about my procedure. I don't know if she realized that there were options.
Dana was my inspiration to kind of pursue having it looked into. And so I was very willing to go and speak with someone because I didn't want to live my life this way. Dr. Walton explained what was going on in my body, and I went and had the surgery. I'm 6 months out now, and it's great. The amazing part was when I was on vacation in July, and my husband and I had a walking tour, and it was supposed to last 3 hours, and the guide said usually at this point it was probably a 2.5. Most people would like to use the restroom, and I said no thank you. And that was my aha moment that I really had gotten to the goal. It was pretty amazing.
You don't often understand the impact that this has on a woman's life. She doesn't always share how much it has changed her life, and when you give her her life back, essentially, it becomes very meaningful.
For more information on how relief from leaks is possible, visit femalepelvicsolutions.com.
And as always, you can go to our website, thebalancingact.com. We'll be back right after this.